Hi everyone, welcome back to another video. This is Dipan. I'm a band 6 radiographer in London, UK. Okay, so in today's video, I'll be discussing about the UK NHS interview pattern and the most common asked questions in the interviews of any NHS jobs or any private healthcare jobs. Okay, so let's start the video. So, like any NHS interview or any private healthcare jobs interview, we can divide it into four parts. First one is the introduction part. Second one is the behavioral or situational question part. Third is the technical question part. Fourth is the question part regarding like candidate temperament or candidate character. So this is the four parts I am like for me I can divide any NHS interview. Okay, so coming to the introduction part of any NHS job interview, like they will ask you a brief description about yourself. They will ask why did you choose this profession. Suppose if you are a radiographer, a therapist, physiotherapist, OT technician, anything. So they will ask you why did you choose this profession, why did you want to become a radiographer or physiotherapist. Then they will ask you why do you want to come to UK. Okay, then they will ask you like any company or any NHS foundation trust. They'll ask you what do you know about our trust or our hospital or our company. Okay, then they'll ask you like where do you want to see yourself in next 5 years. So these are the like common introductory questions they will ask in any NHS jobs interview. Okay. So after the introductory part of the questions over, then they will start asking you about some situational or behavioral questions. Like they can ask you, tell me a time you showed extraordinary patient care. Tell me a time you made mistakes and what did you learn from that mistake. Tell me a time you went above and beyond your expectation. Describe a situation you dealt with a difficult or unhappy patient and what was the outcome. Describe a situation when a patient got angry and how did you manage him. So like this different kind of situational or behavioral questions they will ask you. They can also ask you like you saw one patient and sitting and crying, you went to the patient and you showed empathy, and the patient again starts crying even more. So how do you handle this situation, what you will do to console the patient. So like this different kinds of behavioral questions they will ask you. Then they can also ask you like what are the key health and safety measures you will be concerned when dealing with the patient. How do you maintain privacy and confidentiality of patient. So once this section is over, they are going to ask you some technical questions regarding your profession. So whichever profession you may be, if you are a radiographer, physiotherapist, OT, if you are a lab tech, so they will ask you some technical questions. Like suppose I am a radiographer, so like if you are a radiographer, they can ask you about your X-ray, CT or MRI physics. They can show you some pictures, and they can ask you what is the finding. If there is an artifact, they can ask you what is the artifact and how you can reduce it. uh, they can show some pictures for the anatomy. They will put it like A B C, they'll mark something and you have to tell what is A B C, like that. Okay. And so like, but these technical questions they will ask very less, maybe 20% of technical questions. All other questions will be like other questions. Okay. And also they will ask about the safety, like whichever profession you may be, they will ask some questions regarding safety. Suppose in our profession for radiographer, they can ask you radiation protection, like the and also MRI safety. Okay, so they will ask you what you will do if a pregnant patient comes. What you will do if a patient is having metallic injuries in the eyes. Will you do the MRI or not? They can ask you some what is fat set, what is diffusion. So they will ask technical questions like that, but these are very less. So once the technical part is over, they are going to ask about like the candidate temperament, or they will judge you what kind of person you are. Can you be a good leader, can you be a good team player. So like your character or like that, they will ask some questions like, are you a good team player? What is your understanding of teamwork? Describe a situation when you have done a good teamwork. Then how do you handle pressure? What is trust means to you in respect to your profession? How do you solve issues with your colleagues? You are working in a team and you encountered that one of your co-worker is not contributing properly to the teamwork, and for that your whole team spirit is going down. How do you handle this situation? What are your strengths and weaknesses? Why should we hire you? And at the end they're going to ask you, do you have any question for us? So these are the very commonly asked questions in any NHS jobs or private healthcare jobs interview, and I can guarantee you, you will get some of the questions in your interview for sure, 100% guarantee. Okay, so I'll highly recommend that you should prepare the answer of each of these questions very nicely, so that when you get an interview, or if you have an interview, you can prepare well. Okay. So if anyone having interview in near future, they can contact me. I am happy to help them and happy to guide them regarding the interview. And one very important tip I want to give you: don't take any pressure for any interview. Okay, just think this is a discussion between you and your employer. Okay, so if you think like that, and I can tell from my personal experience that the interview is not actually interview, it's actually a discussion. Okay, you and who is taking the interview, you both will discuss something. Okay, so don't take it as an interview. Okay, keep your mindset like this is a discussion only, then only the interview nerves you get hold of it, and I hope you will pass the interview. Okay, as I told you, it is a discussion, so they will also ask you, do you need a visa sponsorship? What is your notice period? What is your salary expectation? So they you can also discuss regarding these things. Okay, so I would just say, when they ask you salary expectation, you just say your expectation, but don't bargain anything. Okay, let's get first selected, and then you can bargain about, negotiate about the salary. Okay, and when they ask you, do you have any questions for us? Please ask one or two questions regarding, like, you can ask some work patterns, what are the work shifts, you can ask about that, or you can ask about that, when can you join, when can you start, if you are selected. You can ask questions, definitely you should ask questions, because see, all these questions, the same questions will be asked to each and every candidate, and whoever gives the best answer, this candidate only will get selected. Okay, so try your best. And at the end, I would also like to give you some tips regarding your interview. Number one, please have a good internet connection so that you don't get disconnected in between the interview. Number two, use headphones, because some of the interviewer, they may not use headphone, and their voice is not clear to you unless you use headphones. Okay, so use headphones. Third, select a quiet room where there is no sound coming from outside. Fourth, use a good background where you are sitting. Try to use a white or plain background. Okay, nothing fancy in your background. And always put smile on your face, and think it is a discussion, don't think it is an interview. Okay, so if you think this video is little bit helpful for you, please consider subscribing my channel and share. Okay, thank you for watching my video, and hope to see you in the next video.